Ever found yourself sweating at the mere thought of heights or spiders? Why does this happen? Phobias are not just any fear, they are intense, irrational fears that can make your heart race and palms sweat when faced with specific objects or situations. These fears are recognized medically as a type of anxiety disorder, and they can severely impact your daily life, from avoiding certain places to altering your routines drastically. So phobias aren't just fears. They are overwhelming reactions that can control a person's life. What makes your brain treat harmless things as major threats? Well, let's dive into the fascinating world of phobias and uncover the science behind why certain things can trigger such intense fear. At the core of this fear response is the amygdala, a tiny almond-shaped part of the brain that acts as the alarm system for threats. When it perceives danger, whether real or imagined, it springs into action. This activation prompts the release of neurotransmitters like adrenaline and cortisol, which prepare your body for a fight or flight response. Your heart races, your breath quickens, and your muscles ready for immediate action, all because your brain thinks you're under attack. But why do some people develop a phobia while others don't? Genetics play a role, as do environmental influences. If a family member has a phobia, you might be more susceptible to developing it too. Additionally, experiencing or even just witnessing a traumatic event can etch a deep neural pathway in the brain, associating that once neutral stimulus with danger. It's a complex interplay of brain chemistry, genetics, and personal history that locks a phobia in place. From fear of flying to dread of dogs, phobias come in all shapes and sizes. Take arachnophobia, the intense fear of spiders, which can make even a simple basement cleanup feel like a horror movie scene. Or consider acrophobia, the fear of heights, which might stop someone from enjoying breathtaking views from a skyscraper or even climbing a ladder. Then there's claustrophobia, the fear of enclosed spaces. Imagine feeling a wave of panic in an elevator or a small room, making everyday situations like taking a subway particularly distressing. These fears aren't just minor hesitations, they can significantly limit both personal and professional lives. Avoiding certain places, activities, or career paths becomes a norm for many. Understanding these fears is the first step towards managing them. Is it really possible to get over a phobia? Absolutely, and the journey often begins with understanding the available treatments. Cognitive behavioral therapy, commonly known as CBT, is a powerful approach that helps individuals challenge and change their thought patterns and behaviors related to their phobia. Exposure therapy, another effective method, gradually and safely exposes individuals to the source of their fear in a controlled environment, helping them build tolerance and reduce anxiety. For some, medication may also play a role in managing symptoms, especially when combined with therapy. However, it's crucial to emphasize the importance of professional guidance. Navigating the path through a phobia should not be a solitary journey. With the right support, overcoming phobias is not just a possibility, but a reality.